In the case of Sinutib and the one beginning with E, that sounds like a Greek god, you were talking about progression-free survival. What do you mean by progression-free survival? How long does that last? And what affects it? Is it age? And coming on to Philippa, does diet affect this? And is there a way that we can create an environment, specifically in, not my case, but that I'm asking about is the metastases in the liver. Is there any way with diet that we can create an environment within the liver that if we're using Sinutib or we're not using Sinutib and we're just having a watching brief, that we can affect the metastases to make them decrease or stay as they are?
So, first of all, we need to define what is progression-free survival, because sometimes patients get confusing messages when they listen to the word survival. When they say progression-free survival 11 months, this does not mean that the patient dies in 11 months. Progression-free survival means the period of our life that the tumor is stable. So progression-free survival, for example, could be 36 months, 28 months, 48 months. Usually we use months. Okay, so it is the period during which the tumor has not grown. It has nothing to do with the actual overall survival of the patient. Okay. With regards to these new drugs, sunitinib and everolimus, I can give you the commercial name of everolimus, if you can remember it, is Afinitor, and sunitinib is called Sutent. There is one problem. We know that with lutetium or Y90, we can use 3 or 4 cycles, or chemotherapy use some cycles, and then we stop. With these treatments, when we start, we don't know when to stop. We don't have data suggesting that we can use sunitinib or everolimus for 6, 12, 24 months. So as soon as we start the patient on these treatments, we continue until A, the patient has getting more symptoms, or B, the tumor is growing, despite the patient being on this treatment. So as soon as we start and the patient tolerates the treatment, as soon as the patient feels better or the tumor is stable, we continue. And this is on the basis of what we know so far.
I'll just clarify, I'm not a dietitian, I'm a nurse specialist. We're very lucky at the Royal Free, we do have a dietitian that works alongside us. So the question was really about, from a diet point of view, if you've got liver disease, is there something that you should be doing differently from a diet point of view to help maintain that being healthy? That's right, isn't it? The short answer is no. From a diet point of view, what we generally recommend is a balanced, healthy diet. So all the nutritional foods that is generally recommended for all of us. What the dietitians will step in and out, basically, of your care throughout. So if you're starting to lose weight, then they step in and they can look at sort of high-protein diets, supplements, those sorts of things. When you're on these newer drugs, the Sudent, Afinitor, then they can give you a very sore mouth and sore gullet. So again, the dietitian can help step in alongside the medics to help with treatments, to help sort of obviously with the sensitivity, but with ideas about what type of diet you can have to help when it's sort of generally a softer diet, maybe not as spicy, because obviously that would irritate. So things like that you can step in and out of to get that general advice. But I'd say overall it's a balanced, healthy diet with nothing too specialised really, because what we don't want you to do is cut out whole food groups, because everything has its nutritional bonus.